Welcome back, everybody, to our Strategic Medical Brokers channel. Today I have with me Braden Haldeman, who recently joined our firm as an associate broker. So thank you so much for joining, Braden.
Yeah, of course. Of course. Thank you, Kathy. Appreciate it.
So if you wouldn't mind, before we kind of dive into some specific questions that I have for you surrounding buyer financing, would you mind giving an overview of your past professional experience?
Yeah, of course. Believe it or not, my first job out of college in 2012, I can't believe I'm saying it was that long ago. I was brought on to the largest healthcare lending platform in the country with Bank of America Practice Solutions. They were predominantly known, at least on the forefront, for dental financing. They had a breakaway sector for veterinary, which was really successful. And then most recently, and I say recent, it's probably been for the last 5 to 6 years, they've launched a very successful medical lending platform,
Mhm.
which services not just the M&A sector, but also the de novo, so the startup sector for first-time practice owners, expansions, in the multi-practice sector. So they kind of dived headfirst into the medical space, and that's where I had the pleasure of getting the majority of my experience.
And your experience is going to bode very well for you as a broker for medical practices anyway.
I hope so. Yeah,
Yeah.
when you kind of see both ends of the transaction and you're involved from basically the first conversation you have with a potential buyer, and being there in cadence all the way through sponsoring their closing, right, for their open house. If it is a start from scratch practice, or if it's an established practice where they're doing an acquisition, right, I'm there every step of the way. So I had the advantage of seeing both sides of the transaction,
Mhm.
working alongside the attorneys, the CPAs, the buyers, the sellers, the brokers, which is ultimately why I'm here, because I did a handful of transactions that were successful with Sean, our founder and lead broker for the company.
Mhm.
Ultimately, that's what led me here. So, yes.
Great. So, what I want to focus on today really is buyer financing. I know that we can talk a little bit later about how the seller will be affected, but for today, if we could just kind of focus on what it means for a buyer, what they should look for, and what they can anticipate from the process. So, first, if you wouldn't mind just giving an overview of the financing process for the buyer, all the way from applying for the loan all the way through closing.
Yeah. And it can sound daunting, especially for the first time practice owner who's done with residency, that's worked for, corporate medicine or a hospital setting. And now they're taking this leap of faith where they're now becoming a cornerstone in their community. They're going to buy a practice that's established, and they're going to kind of carry on that baton from the now seller who started this clinic 20, 30 years ago, right?
Mhm.
No pressure. But now they're talking to a lender, and they need to fill out credit applications. They need to get their credit pulled. They need to submit production reports. They're hit with this task that takes a lot of time to gather, right? So they're not only getting their own financials squared away, but they're also going to be tasked with typically getting the seller financials squared away. And they're going through these credit interviews, and they're talking to the underwriter, and they're working with a bank rep, and it's going to be very new for them. Typically, if they haven't done the process before, it can be a little bit scary. So picking the right lender off the cusp is going to save not only time, but it's going to save a lot of sanity when it comes to a buyer that's going through this process. So
So I'm wondering, obviously something that they could equate it to is a real estate purchase. So I'm not sure how much experience you've had with that, but it's obviously way more involved, way more complex, and certainly a longer time period that they're, working to get this closed.
yeah, and a lot of them would come to me at that phase of my career where, hey, I've got great credit and I've got some money in the bank, so no issues, right? I should just be able to get approved for financing. And I'd have to kind of pull back on the reins and say, hey, this is a puzzle piece between you and the practice you're looking to buy, right? It's dollars in versus dollars out. You may be a qualified buyer, but if you're not purchasing a clinic that's profitable, that can withhold your own personal living expenses, right? There's going to be questions that we need to explain to the analyst. And it's my job to hold your hand, buyer, and your hand, analyst, and walk us down the path of, hey,
Mhm.
why does this transaction make sense? So we'll hear cash flow a lot, right? Does the practice cash flow? Does the transaction cash flow? Essentially, what that means is the practice that you're buying, doctor, is it pushing off enough income to support you and your family both personally, but plus the new business sets you're taking out from a lender, it's going to be for a very specific debt service coverage. So it's really dollars in versus dollars out. It's not, hey, buyer, are you qualified? It's buyer, do you fit that puzzle piece of the seller, and is it a good match for you both?
Hmm. Absolutely.
But
So, of course, there are, every deal that we work is structured differently, but to kind of hone in on the individual buyer purchasing either a solo provider practice or perhaps a multi provider practice, what are the different financing options, maybe the top three, if there are many, the top three most commonly used that are available to buyers who are looking to acquire a medical practice?
yeah. I'd say the most advantageous for a buyer is to do conventional financing. It's not that I don't like SBA. It comes with its own nuances, right? And when you're working, and if you're a doctor, if you're an MD, a DO, OD, right, and if you've got those letters at the end of your name, right, you qualify for very special financing. And there's a few
Mhm.
banks that have really capitalized on offering a lending platform only for doctors. And typically that means conventional financing is going to be available for you for not just the practice, but also for the real property if it's available to come along with it.
Mhm.
And when you're purchasing established practice, I mean, you could do this for as little as no money down for the clinic, for sure, and even potentially for the property. So conventional financing is going to be the first choice, the first avenue, if you are a qualified buyer and the practice is substantial from a cash flow standpoint.
And the
Uh,
hardest to get, I'm sure.
hardest to get. It is the hardest to get, but it is for sure the most advantageous. Uh,
Hmm.
and then next is obviously going to be the SBA financing, and that'll typically be if you're a first-time practice owner, an SBA 7A if you're buying the real estate. Sometimes they'll do a 504. I'm not an SBA specialist. Most of my clients would qualify, and I would seek clients that would qualify for conventional.
Hmm.
But some benefits of the SBA, they're usually longer terms, right? They are backed by the SBA, so the bank's not taking all of the brunt of the risk. So sometimes there can be some lower fees, um, easier ability to get financed, right? But you probably won't see the interest rates that you will on the conventional loan.
Hmm. Okay. And you touched on this a little bit, but what are some of the, just for, considering buyers who are considering so they can kind of be well versed in what to expect?
Mhm.
What are some of the nuances or some of the pitfalls that they should be aware of when they're trying to apply for financing?
There's three things ideally. The first is starting too late in the process, right? If you're already going through negotiations and you're ready to sign an LOI and you haven't started the process with a lender, and you'd be shocked, Kathy, and I mean you see this all the time,
Hmm.
where we're negotiating LOIs and the buyer is still getting introduced to lenders. So one is starting too late in the process, right? Two is not picking the right lender.
Hmm.
You're not surrounding yourself with a medical specific lender, attorney, CPA, these specialists that speak your language. You're doing yourself a disservice.
Hmm.
Uh, and the easiest way to vet that out is when you do bring on, excuse me, a medical specific CPA, when you do bring on a medical specific attorney, if you ask them, hey, who are the best lenders in the space, you're more times than not going to hear the same name multiple times. And it's always worth your due diligence to go talk to those individuals versus go
Hmm.
to your local SBA rep, Bank of Arizona, right? Something that's on the street corner that specializes in all types of financing, not just medical. But ideally, the buyer's approach should be seeking out a medical specific lending platform. That's going to save them a lot of time. And they're going to learn a lot too.
Yep.
Then the third pitfall is putting interest rate first, I'd say. I can't tell you how many times I would get phone calls from prospective buyers, prospective clients. Their one and only question is, "Hey, what's your interest rate? What's your interest rate? What are your fees?" If that's your top, if that's in your top three questions as a buyer, you're asking the wrong questions, right? There are so many things that are more important than just interest rate when it comes to lending and ease of use with a platform from a bank. Um, Because in all reality, the average transaction or the average loan for a buyer is going to take you 7 to 10 years to pay that off for the clinic.
Mhm.
um, that bank is now your partner. It is your business partner, right? You're more likely than not having to do your deposits with this bank. You're going to have a business credit card. You're going to have merchant services, payroll. You're going to have all these different aspects that are attached to you from a lender. And you're going to want to choose that partner wisely. If the closest branch is 40 miles away and you're a cash practice, right? Where are you going to go deposit your
Right.
cash? You're going to
Yeah.
drive that far away. All these little things to really think about where, interest rate, yeah, it's important, but it's probably not top three.
Great considerations. And then if you had a buyer, approach you ahead of time that they are kind of giving themselves some time to plan and prepare, what advice would you give a buyer who's planning and their time frames about 1 to 2 years out?
Yeah. Be curious, talk to as many people as you possibly can. One thing that I would offer my clients is, hey, I've helped doctors that have been in your situation 5 years ago, right? Well, now they are established practice owners, and let's say it's a plastic surgeon. I would give them an introduction to a plastic surgeon that I helped 3, 5, 7 years ago, whatever that is, so they can actually get hands-on real experience from a doctor that not just worked with myself, but went through the process and can really talk to them from a doctor standpoint on, hey, here's what I experienced. Here are things to look out for, uh,
Mm-hmm.
and ultimately help them, make them feel a little bit more comfortable because ownership is scary, right? Now you're going to have employees that depend on you. Now your practice is what's bringing home to put food on the table, right? You're no longer working for just a paycheck at corporate medicine, in a hospital setting, or as an associate. You are now the one steering the boat in your clinic. So
Great advice. And then how would that advice differ for somebody who comes and perhaps is 3 to 5 years out from that goal?
when that's the case, 3 to 5 years out, I mean that's a long way out. There's so many things that change just environmentally, financially, different options even for financing change in 3 to 5 years from lending perspectives. But that's where, hey, we'd have the pre-qualification conversation of,
Mhm.
let's see, hey, let's see where your markers are, all your health markers are for you personally, financially, and let's see what we need to fix to get you there. So then there's no questions asked on your bankability when 3 to 5 years is now up, and now it's coming time to ask for the money from the bank.
Mhm. Great. And then, of course, we primarily represent the seller. They're our main client, but we do help with the buyer and coordinating with the lender. So that's really our role in the financing perspective. But what from what you have seen, what is the workload on the seller's end? What information do they need to provide? Documentation? What's their level of involvement throughout the buyer's journey of obtaining financing?
Yeah, and the reason why I'm smiling a little bit is because they have no idea the amount of legwork that goes into it. They think, oh, we've got a great buyer, and I've got this beautiful practice, and they're just gonna end up with a bucket of money in a couple months. there are there are a handful of financials that are needed from the seller. I mean, more likely than not, a lender's going to want at least 3 years of business tax returns and balance sheets from the clinic, plus the most recent year's profit and loss statement. If there's a tax return that's on extension, like for instance, right now we're in May of 2026, and we're getting a lot of 2025 profit and loss statements, because the doctors are on extension. Well, lender's going to want the extension document too to prove it that you're on
Right,
extension.
right.
There, we're going to want, since we do our recasting, right? We're doing our add backs in the clinic. We're going to want different statements from your CPA to show all of the owner benefit expenses that are built into the clinic, right? We're going to want to see W-2 statements. We're going to want to see payroll summary reports.
Hmm.
And then there's a lot of due diligence items. The buyer's not just going to take your word for it when they go to buy your clinic. They're going to have questions. They're going to want to see documentation. They're going to want to see CPT reports. They're going to want to see a handful of these items that us as brokers are responsible for obtaining from the seller, right? And there is a lot of legwork that goes into it, but that's ultimately what we do. That's why we have a job. We take a lot of that weight off of the seller and subsequently the buyer to help the transaction operate smoothly.
Absolutely. Well, thank you so much, Braden. I really appreciate your time.
Of course. Thanks, Kathy. I appreciate you.